Hi guys, this is Dr. Afrah, cosmetic physician and general practitioner. And as promised, I am joining you guys with Dr. Michael Rich, and we will be chatting about thread lifts. This is a very popular topic at the moment. Everyone wants to know about thread lifts. Everyone wants to know how good they are. Do they actually work? What's the downtime? So I'm just going to invite Dr. Rich to join, and then we can ask him all these questions because I know we have a million questions for him. So just waiting for him to join. Hi, Michael.
Hi, Afrah.
Thank you so much for giving us your time on a Sunday because I know it's like the only day that you get off, isn't it? Usually you don't even have Sundays off.
No, I've done some work today. It's been good. I've caught up.
That's fantastic. So I thought I would start with just letting you speak about your experience, your past experience, as in why are we talking about thread lifts with you? How long you've been doing them for? What did you do before thread lifts? So just a really sort of brief little blurb about yourself and your experience, and then we'll jump into the actual thread lifts and the nitty gritty of it all. So why don't we start with you?
Okay, we're talking about thread lifts because you asked me to talk about them. That's the starting point. But look, thread lifts and suture lifts have been around for quite a time. It first came about, I think it must be about 25 years ago, the Afrah thread. And a Russian guy, I'm just trying to sell I'm trying to remember his name. And he developed threads. He actually got nylon or other types of materials, and he made little cuts in the thread by hand to try to get them to grip and hold. And then he sold them, and look, they were quite helpful, but they hung around for a long time, and occasionally people got inflammation, infection, but they're still available in a much more refined form these days. So you can still use the old Afrah threads, but he was the first person in the world, right? And then a few years later, Des Fernandez, a plastic surgeon in South Africa, developed the suture lift. It's interesting because he was the first one to develop the needling and roller and he postulated needling the skin stimulates collagen and tightens up scarring. And it was really his work was really the beginning of what we call fractional lasers, treating a percentage and healing quickly. But I'm digressing. But so he developed the suture lift, which is really putting stitches in which last nylon proline, which lasts a long time, 10, 20 years even. The sutures hang around, and you create a loop, a circuit that lifts the skin and continues to do it for a long, long time, right? So, and that I would have thought he did it at the same time as developed needling. So that's 15 to 20 years ago. So I used the Afrah in the beginning when it first came out. I still use the Fernandez technique, but always obviously modified over 20 years, still today. And then in more recent times, the PDO, the polydiadenone threads, they totally dissolve. That came out in the last few years, and those thread lifts they're less aggressive. They totally dissolve in 6 to 8 months. You often have zero downtime or 1 or 2 days of discomfort, and you really can put in 6, 10, 12 threads, and if it's not enough, you're going to go back a month, 2 months, 3 months later and put 1 or 2 extra in to get a further lift. So the suture lift, the more permanent sutures, hang around for years, and the thread lifts dissolve in 6 to 8 months. I suppose I'll elaborate a little bit. You can ask me questions in a second. Why one and why not the other? So the suture lift takes quite a few hours to put in. It does hang around for years. Sometimes years later, the thread we made the knots tries to eject itself. You've got to rebury it or remove it, right? And that constant lifting and tightening stimulates a bit of collagen. And even you remove the sutures after years, it tends to hold to some extent, as opposed to the thread lift, which people say lasts up to a year, maybe a year and a half. But I think the benefit is beyond that. But you can go back and put more threads as people need. So it's a bit like using fillers, but you get a good fill and you don't wait for it to go all the way back. Maybe 6 months or 12 months later, you just top it up a little bit and maintain the benefit. The other thing I think with the thread lifts is it's a little bit like fillers again, that they stimulate collagen, elastic fibers, So I think there's a long-lasting benefit in terms of collagen formation and quality of skin. So they're not exactly the same. They overlap, but they serve a slightly different purpose. The Suture Lift is better for the older person with a lot of laxity. It will lift it better. The Thread Lift is for a younger person with not as much drop. You don't want to put a stitch in and cause a really high elevation, but it does elevate a jowl or a nasolabial gently, and it stimulates collagen, has long-term anti-aging benefits.
So going back to the Suture Lift, so has that been around for a lot longer than the Thread Lift? Because they're two different things. I want
Well,
to just
yeah, well,
make
it's yeah.
So they're two different things. Suture lift is something different, which we're doing with a different sort of threads, and then the thread lift is something different. So the suture lift is the one that's called the mini facelift. Is that correct?
Correct. No, it's interesting. In fact, both have been around for 20, 25 years because the Apthos was not it was sort of a permanent type stitch that left barbs in the skin to hold better. And they came out about the same time. The Fernandez loop that you did a circle and elevated the skin. Now, but the thread lifts are a newer phenomena in that they totally dissolve. Like very similar to the material using fillers, right? They totally disappear. So you don't have a foreign body present anywhere between 6 to 10 months later, right? So they're new.
So with the suture lift, my understanding is that it's lifting the skin and then it's keeping that skin anchored into the area where it's been lifted, where you've made the cut and then you've sutured it with this special thread. And it's not a facelift because a facelift is lifting the deeper structures as well. It's lifting muscle, it's lifting ligaments, it's lifting others. So the suture lift is lifting skin. Is that correct?
Yeah, it is. It's not, I mean, the facelift, the suture lift, the thread lift are all totally different animals in a way. A facelift, you're right, not only that, but you make cuts you cut, you remove extra skin, you tighten muscle, you tighten fascia, and it's a totally different procedure to the suture lift. The suture lift is an outpatient procedure. It's not that uncomfortable. It takes hours, but it's not uncomfortable. You just create loops in the skin, and the angles are infinitum for both thread and suture lifts. But the stitches hang around, so you're lifting the skin and you're holding the skin up, right? But you're not removing excess skin, etc. That's the difference, right? And whereby the thread, it just gives a tight lift, a mild lift. It's subtle, but certainly in a younger, reasonably tight face, it's quite a nice procedure.
So also with going back to the suture lift, because I want to talk about the suture lift a bit more, and then we'll move on to the thread lifts and talk about the mono thread as well, maybe. So with the suture lift, once you've lifted the skin, Michael, isn't the skin going to keep growing in the next couple of years? Because skin keeps growing. So how long will that suture lift last the patient, keeping in mind that the skin keeps growing? It's an envelope that keeps getting bigger.
Yeah, well, not exactly gets bigger. Sorry, it gets more lax.
Okay.
Laxity is different, okay? And there's no question that if you look at someone between 70 and 80, they're more lax. You look at between 50 and 60, they're more lax. So as with time, we lose elasticity and we get laxity, right? That's why we can move. So there's no question. But nevertheless, because the sutures have continued, the suture lift can hold for years. It's still elevating the skin beyond what the drop would have been, right? That's what it's doing. So even 10 years later, it's still keeping it up a bit. But having said that, although in the suture lift, they're not fancy, they're not expensive materials like they are. It's just, I use simple nylon. I used to use Proline, but that was too long, right? The nylon does tend to just melt a bit or dissolve a bit in 5, 10, or 15 years. Proline never does. So, and you can use, and I'm now using a thinner nylon, a 5. I used to use 3/0, and now I'm using 4/0, 5/0. So it's a much thinner thread, but it just keeps the skin elevated. But often if you remove the thread, you don't get much of a drop because collagen has formed where the thread has been, and it's maintained the tightness.
So is from the point of view of physiologically what's happening at the site where this suture lift has been, or the suture has been inserted, is there also some scar formation that will also create a lift?
Yeah, there's internal collagen formation. You can't usually feel any internal scar, but there is definitely collagen formation along the track of the suture. Not as much as the thread lift, the Aptos thread, the first one with the little barbs in the nylon that was cut into the nylon. These have got now they've got bidirectional threads in some of these threads, so they hold up and down, and these threads don't lift and hold before they dissolve, but those threads stimulate a lot of collagen and elastic fiber formation, right? So that's the benefit long term.
Okay, great. Now, very briefly, can you talk us through the actual procedure for the suture lift? What's involved in the procedure? What kind of discomfort are we looking at? How do we make sure the patient is comfortable?
Right. Okay. Well, with the suture lift, it's not too uncomfortable. You're basically on a normal. If I'm using a full face, most likely we use something like 9 sutures, 9 loops, and you put a little bit of local along the track where the loops will go, and a bit of local where the holes are made, right? So let's say lifting towards the jowls and lifting up towards the scalp, I might have 3 holes for it's basically 6 sutures, right? And so you have to make a little hole. You put a local, and you put a hole local along the direction. Now that stinks for about, honestly, 30-60 seconds. Thereafter, you feel nothing. But it can be a bit painful. It can be a bit painful for a few days afterwards. Some of these sutures are tied right behind the ear, and there's cartilage there, and that can be a bit uncomfortable. So there can be 3, 4, 5 days of pain where you've tied your knots, but the procedure itself is not uncomfortable. You can drive home afterwards, right? You can drive home. A little bit of swelling. So basically, you make let's say 3 holes around the scalp to hide them, and 2 or 3 behind the ear, and you create loops, and you bring the stitch back there, and you pull and you tighten the skin. It's like a circle, a semicircle. The stitch goes in, comes back, and pulls on the skin, and you gradually. So let's say lifting, going the jowl towards the ear, you might put 3 stitches supporting each other there, and going upwards, you might put 6 stitches supporting each other, right? It's slowly putting them in the correct spot, slowly tying them, slowly burying them, slowly stitching up the holes, but it's not uncomfortable. I always tell my patients the most uncomfortable part of the whole procedure is having your head to one side for about over an hour, right? You just got to have your head to the side, and so that's really it.
What about downtime, Michael? So besides the discomfort that may last a few days, what about bruising, swelling? Can the patient go
Usually
out in
not.
public?
Yeah.
Will people
Okay.
notice?
Usually not too much bruising. Occasionally, look, whenever you put, as you know, when you put fillers in, for example, the needle might hit a pipe, and that pipe leaks, and 0.1 of a mil of blood, hardly anything, can leave a stain which can hang around for weeks. So you can hit a vessel, but usually not much bruising. Usually not. There can be pain for a few days afterwards. Can be a little bit of swelling. The other thing that can be noticeable, because with the loops, we're tightening the skin. So there is a fold where you've tightened it, usually in front of the ear, right? Just here in front of the ear or behind. So there's a fold. And when I first started suture lifts, doing them 20 years, I used to warn all patients, if the fold doesn't go, we might have to cut out the excess skin, right? Now, what I've learned over the years, the bigger the fold, the better it is. It always goes, and the tightening is better. So the fold always goes, and we get more tightening. But in the beginning, you can see that fold, right? You can see that fold. But in most of the patients we do the suture lifts are females, and they just put their hair over in front of the ear, and you can't tell.
Now, also, when you're doing the suture lift, do you tend to do it as a procedure on its own, or do you tend to mix it up and add other things to it?
Yeah, well, that's an interesting question. I mean, some things you can do on because you can't work in the same area. I've done certainly a lot of neck and chin and neck and jowl liposuctions at the same time, because you improve, that's a different area, and you can do that, you can work the two together. But your question is appropriate in that a suture lift, all it does is tighten the envelope, right? And it doesn't tighten the envelope in the way of facelift. Sometimes they get tightened fascia and muscles and so on. This is just tightening the skin. Now, if you've got laxity or wrinkles, it won't help that to that extent. If you've got volume loss, it's not the preferred treatment. If you've got pigmentation, if you've got open blood vessels, it won't help that. So all it is tightening the envelope, and not in the same way a facelift does. That's a suture lift for the slightly older person, right? So so if you're relying on a suture lift when there's significant volume loss, when there's significant wrinkling and pigmentation, you need to do the other things. Sometimes it's more important than the suture lift. But if you're looking purely for a skin tightener, yes, it's a good procedure, because if you don't want to go through full facelift.
Now, I believe there was a question about which age would you, or which patients would you recommend just a suture lift for?
I usually don't recommend the suture lift for a 20, 30-year-old. I don't think it's appropriate for them, unless something's happened, like a lot of weight loss and there's a lot of laxity, right? Because it's horses for courses. Everybody's different, and you should assess each patient as an individual, really. But so at 20, 30, 40s, when a thread lift might be more appropriate. Beyond that age, when you're looking a lot of loose skin and a lot of wrinkling, and it doesn't necessarily improve wrinkling, but it will, if there's a lot of laxity, and you can look at the wrinkling afterwards with lasers or other devices. But you can get, that's an age, 40 onwards with looseness, it's a good treatment. And it's a procedure you can even do on 70-year-olds. It's not as effective on a very heavy face, because you've got 6 or 9 sutures holding up the skin. And if there's a lot of volume, a lot of weight there, it may not hold it up as well.
Okay. Also, do you sometimes mix up the suture lift with thread lifts as well? Do you do?
Yeah, no, absolutely. You can. I suppose you would. I usually would start with a suture lift, and then the thread lift will be the icing on the cake, because they're quite. You might just put, okay, you've got a good lift, but you want a tiny bit more here, a tiny bit more. My nasolabial I'd like a little bit elevated, or a marionette area. So you can go back and do a couple of threads just to bolster it. It's not common, but we have done it a few times. But because most people find the suture lift, certainly in the early stage, is quite beneficial. Maybe years down the road, they don't want to go for another one, then you can put a few threads to help it.
Okay, now let's move on to thread lifts. How many different kinds of threads are there, and what are they?
Okay, there's many. Apthos is still around. 25 years ago, I haven't used it for years. I remember I was one of the first to use it, I guess, in Australia. But look, there's different brands, and I've got to be careful. I suppose the Silhouette and the Mint, the ones that I personally use the most, the material is, I think, just about identical, similar benefits. It's going to be difficult. I mean, I use I favor one at the moment, but they both do a similar job, right? The Mint thread, you insert it from one end, and so there's one little tiny hole. It doesn't leave a mark whatsoever. You might do it from, let's say, just at the hairline and move it down and lift. The Silhouette, you make the hole in the middle, and the thread goes both ways, up and down, right? So there is a hole in the middle. It doesn't leave a mark. Occasionally you get a little punctum for a while, okay? So, but they have similar benefits, and I think it's just, and the advantage of them that you can, as I said, you can change your angles of those infinitum, and depending on weight. So, oh, that nasolabial is a bit heavier. I'll put 3 stitches on that nasolabial. This one only 2, but I'd put 2 or 3 in the marionette and 2 or 3 on, in the jowl. So you have a look at what bothers any given individual, and I think if you've not had any thread, you need at least 6 per side. But you can go back and say, look, if it's not enough, come back, we'll do a couple more in a month or 2 months, whatever people want, right?
Also with the thread lifts, Michael, sometimes people can have that dimple form after the procedure. Have you noticed that as well? Or is
Sorry,
that
I missed, you cut out there. Sorry, I missed it. Say
so? Also with the thread lifts, people sometimes have that dimple formation in the area where it's inserted.
yeah,
So can you talk
yeah.
about that?
Yeah, that sometimes happens with the silhouette when you come from the middle, first of all, right? But you can actually, it usually goes. I don't usually worry about it. And I try not to do anything for at least a month, to be honest, if it happens. You can actually release it with just about pinching it and so on. But you don't want to decrease the lift, right? Let the lift go as best as possible, right? And get collagen. And if that, because it often releases, right? But you can pinch it. But one of the reasons for it is really you've got to make sure you're in the dermis, not below and in the mid dermis and not above, really. Not superficial and not, it's a bit like Goldilocks and the porridge. Too hot, too cold, or just right. Too superficial is not right, it causes dimpling. Too deep doesn't elevate, right? So it's a matter of being right. And so that's the story. Having used inserting sutures and threads now for 25 years, I find that getting the right level is quite easy, but occasionally it can be wrong. You basically, before you commit to play the thread, releasing the thread, you've got a little tube and you can lift it up and see that you're exactly in the same depth through the whole line of insertion. And that's really important because if you see contour variation, they will give dimpling, and that can affect the result. But basically, those irregularities just about always go, and you can release them with a bit of pinching and sort of massaging that area but preferably not.
Now you spoke about the mint and the silhouette. Can you tell us the differences between the two?
Yeah, well, as I said, they're the same. They do, as I said, to my mind, they do nearly the identical job, right? You can place them in multiple angles, the same particular way. They all have variation. They all have little fine threads as well, which are being used today in a different way, which more in our practice, more the nurses do. They're ones that just stimulate with collagen and cause a bit of help fine wrinkling. So you can put 40, 50 or 60 of these little fine threads in, very fine ones, which improve that. But in regards to the thread lifts that lift the skin and so on, they're the same material. You place them in the same positions and you use the same angles. As I said, the difference is the silhouette goes in the middle and goes both ways, and maybe can give a bit better elevation, but you've got a bigger chance of having a little mark in the middle, whereby the mint only you start at one end and usually in a hidden end and around the hairline or behind, around the ear or something like that, or in front of the ear, and so there's nothing in the middle, right? It is bi-directional, but it's not the thread going both ways. And so with the silhouette, you can sort of use one thread, does one half to hold and the bottom part to lift. So you can vary a little bit what you're doing with the silhouette. Okay, but I think the mint's a little bit easier to use.
So are you saying that with the mint, people would have less risk of that dimpling?
I think if it's done correctly with someone's experience, there shouldn't be any dimpling with the silhouette.
Okay. Now, can I also ask you about barb versus non-barb wires, threads?
Well, I mean, that's the difference. That's what I was talking about. Different. The suture lift is not barb. It's just a plain nylon, an ordinary nylon that you suture the skin, right? That's what I use these days. And so I used to use Proline. It's a totally smooth suture. As I said, the first barb suture was Apthos, where this guy in Russia got a thick nylon and with his own knife hand made them, cutting little barbs to get lift. That was the first. They were the first barb sutures. So when one does a loop to lift with the suture lift, you're just getting a lift from a loop. You've got a stitch go in, circles and comes back. So it's that loop lifts the skin. And if you put 9 of them, you get 9 loops. And if you place them correctly. whereby all the other threads are barbed, right? Even the very fine one we use to stimulate, the one people have 40, 50 or 60 put in, around the temples and around the face, just to get rid of wrinkling a little bit. So they're all barbed to a lesser or greater extent, but some are bidirectional, some are monodirectional. So the bidirectional gets to lift both ways, the mono only one way, okay? In principle, I think bidirectional is a little bit better because you're getting a pull both ways, you're getting a better lift.
So with the barb threads, do people have more discomfort because of the barbs? Can they feel more sensitive?
No. I think the aphthos in the old days definitely could give some discomfort, especially if placed too superficially, etc. But the modern ones are terrific. There's really no discomfort afterwards at all. Maybe you can, and even putting it in, can use a bit of local in the track, but sometimes you just put a bit of local in where you enter, and it's really, a lot of times people can just cope with it just without any local. Depends on people's threshold. Some people find even minor discomfort unpleasant, so you might put a bit of local, but you can actually do these threads without even using a local, and then you get no bruising, much less bruising than a local. But no, they don't feel the barbs, no, unless you're too superficial.
Okay. So the other question I had was, with a lot of procedures that are obviously invasive in that way that it's under the skin, there sometimes can be other structures that are affected. Every time, like you said, we put a needle in someone's face, we might hit a pipe. Sometimes we can also hit nerves. So is it common or rare for people with thread lifts to have nerve pain?
No, I don't think it's common. I've certainly not seen it in 25 years of using different types of materials to elevate. It shouldn't, because nerves, to break kind of nerve, we're using blunt instruments, blunt, and nerves are pretty good. They're elastic and they move away. I mean, unlike you might get a slight sensory change. If you get a motor, it might be like a dental block, but even then, you're not using local. You just might irritate the nerve slightly but no, it's unlikely to happen.
Okay, so the other question I wanted to ask you was about the patient we both had recently. She had the thread lift and she felt she had unevenness, and it was not done with you, obviously. The thread lift was done somewhere else, but she'd been quite unhappy with the unevenness of the skin under the thread or around the thread. So can you comment on?
Look, I mean, there's a couple of points. I'm trying to remember exactly what her issues were, but look, as I said, you can put the sutures too superficial and leave contour variation. Number one. Number two, if you don't place them in a similar way in both sides, it will cause a different shape. Having said that, there's not a face in the world that I personally, and same with you, cannot pick 20 differences from one side to the other. It's just bad. Never see symmetry. So people, they notice when they've had procedures done, whether it's a liposuction or fillers, or they notice the fact that they're not similar, whereby they were just as much not similar before, sometimes even more obviously, they never noticed it, right? So people start looking at asymmetry after they've had procedures, and it's very important that asymmetry is pointed out before you do the procedure, right? I mean, I recently did a liposuction on a lady. On one breast, she was an E on one breast and a C plus on the other. And we did one breast, and she came to me afterwards and said, I wish I would have done it 20 years ago. But the point is people are not symmetrical. Absolutely not symmetrical. So, but contour variation can be by going to superficial, or you haven't really looked at both sides and you haven't used similar angles when you put in the threads, right? It's very important to mark in the way, and you actually, when you mark, I like to show the patients, I sort of pull along my line and say, is this what you want? And I do both sides. So at least people have an idea of the type of lift you're getting, right? So I don't exactly know with that patient. I'm not sure what thread she had exactly. I'm not sure how it was done. I don't know how many threads she had put in, and I don't know what you look like before the thread. That's always a problem when they come, but as you know, we see a hell of a lot of patients coming in unhappy with what's been done, and it's always difficult because we weren't a party to what happened before, and we don't 100% often know what was done and the technique utilized.
Now, can I also quickly ask you about the mono threads? Can you talk to us a little bit about those? The 40.
Yeah, talk about the little tiny threads. Yeah, they're still threads, which are barbed and so on. And what they're doing, and it's something that has become quite popular. Look, I'm not 100% convinced, because people are having numerous threads put in, and we've recently in our practice have got a lot of these, and we're going to be using them more. But is it more beneficial than other procedures which tighten the skin a little bit, or radiofrequency needling, or even ultraformer which tightens the skin a bit, and so on? I'm not sure, but it's safe. It's really, really safe, and the feeling is that it does stimulate collagen and it improves fine wrinkles. So there's no question it does something. The question is it worth the cost? Because you really have to put a lot of these small fine threads in to get a benefit. And I'm talking 30, 40, 50, 60, right, to get a benefit. But yeah, they do something, that's for sure.
So would you say that they're more beneficial for areas that we cannot target with other treatments, such as laser?
I mean, I think, look, sometimes, if they don't want downtime, sometimes, let's say, wrinkling around the mid-face, often severe wrinkling, and you don't want to have an aggressive laser treatment with downtime, if you put these often enough, you will get some improvement, a bit of tightening, right? So as an example, and sometimes around the forehead and temple areas, and cause a bit of lifting of the eyebrow, a bit of improvement of the quality of skin around that sun-damaged temple area, which is often quite common. So you can use them in and around the marionettes and around the nasolabial areas, again, to get a little bit of tightening, a bit of improvement, and improve the quality of skin in that area.
Now, the other thing I'll just mention, and not specifically, it's not a question, but you can expand on it, but I just want to mention that we have so many lasers at the Enrich Clinic. There's so many lasers, and they all do such a fantastic job of collagen production and skin tightening that sometimes it's really hard to pick one treatment for a patient, because we can offer them maybe 5 that will suit them. So how do you decide which treatment is best for a patient? And I know that I know the answer to this question, but the patients don't know, and the people watching us might not know. So how do you decide which, because you have every laser that I can think of, so how do you decide?
I mean, it's basically you're treating the individual. That's the starting point. You really are treating the individual. And so you might have, let's say, 10 patients with acne scarring and similar, right? And one of them, they will do anything. I don't mind having 3 weeks downtime. I just want to get these wrinkles, these scars as best as possible. Others say, look, I don't want to miss a day's work. It's an issue for me. Others, the cost becomes a factor. So you can get improvements with more aggressive treatments and downtime treatments. Now, obviously, if someone has why would you have a downtime treatment if you could get the same result without a downtime treatment? And often not, right? That's the first thing. So you've got to gear to that patient's need and what they need, what they can afford cost-wise, and what they can tolerate discomfort-wise. That's the first point. So you're treating the individual. The second point is that, I'll give you an example. Let's say pigmentation, okay? And you have one device, and you've tried to pigeonhole everyone into that one device. And some people don't necessarily always do well with the one device, right? They don't always necessarily do well with that. So let's say the Fraxel 9027, the thallium component, is possibly, I say, the best wash of a dirty face, okay? But not everybody clears, and some people with darker skin are prone to a bit of post-inflammatory pigmentation, or some of the darker lentiginous don't respond that well. So you've given that treatment, you say, okay, that was never going to be enough, but we can follow up with a pico laser, or one treatment you don't want downtime again, we'll give you an IPL. So we can cater by having options, we can follow up with the next step. If all we had to offer was the Fraxel, we couldn't finish the job. So and sometimes it is expensive to have 10 devices that treat pigment. Okay, and it is expensive. You're wondering why, but the point is, to give the best possible treatment, you have to give the treatment to the individual one, but be able to follow up to finish the job, because often one treatment is not enough to get an adequate benefit, and that initial device has to be supplemented with another device.
Okay, I'm so grateful for your time, Michael. I'm going to ask you one last question and then I'll let you. In which patient would you recommend something like the portrait laser? And you don't have to go into what the portrait laser, I'll just quickly say an ablative laser, actually, something that is going to take the top layer of the skin off and create that collagen and real tightening and just reduction of scars and fine lines, all of that benefit, versus someone who needs the suture lift. How do you pick which patient could have the portrait, which has similar benefits to someone who has the suture lift?
Okay, I think that, look, the suture lift is purely for the very relaxed face. It tightens it, right? To my mind, the portrait is an amazing device. It's really, not even a laser, it's a plasma system. It's a gas system that heats the skin, and it's good for all skin types, all colors, but it gives significant downtime. I always say it's not for a virginal patient, because it does give significant downtime, and someone who hasn't had some treatments before may not be able to cope with the portrait, except around the eyes. But what the portrait does, it treats many components of the aging process. It does tighten the skin. It gives a volume effect. What I call washes the dirty wall, because it gets rid of all the pigment. So you've got nicer complexion, you've got tighter skin, and you've got some a volume-like effect because of the lift, right? So whereby the suture lift is purely a lift. So for the very, very saggy face, the suture lift will do more. But for a person who's lost volume, who's got wrinkling, who's got pigmentation from sun damage, the portrait, it's one of the few devices that treats the whole package. The only thing it doesn't treat is open blood vessels. Right? It doesn't improve them at all. But the portrait, as I said, you have to be ready for downtime. And when you look at yourself, you worry. And the portrait patients, we've got to check 2-3 times a week for the next 2 to 3 weeks to hold their hand, right? Although they're tightening around the upper eyelids and lower eyelids, that's fine. It's a week and they look like a panda. That's quite a dramatic result. That's all right for patients who haven't had other things done.
So in a nutshell, I guess patients should be choosing treatments, one, based on expert advice and individual advice, a tailored advice. Secondly, downtime and of course cost. And thirdly, what they can tolerate as well, I suppose, in terms of downtime, pain, etc.
Right.
And that point of view, the best thing would be to come in and see you in person, because even if it's someone like me who knows about these things, give advice, the best person to obviously have assessed them and advise if they're suitable for the procedures and which procedures would suit them best is to go to someone who's been doing it for a very long time and is an expert in the field. And that's where you'd get the best advice and, of course, the best treatment as well.
Yeah. Well, hopefully they get good treatment, and they can come in. And if they want, they come in. We've got a cosmetic consultant as well, Mary, who understands a lot of these things. And then she often calls me in to have a quick look to see if I agree with what she suggested. So they can have a consult, which is very cheap, with Mary, and they can have a discussion, and then and if they're interested at that point, we can follow up with a more detailed discussion and explanation.
And just to finish off, I think one of your patients actually joined us, and she actually did say she's had the portrait around her eyelids and she's seen great results. So I thought I'd just let you know, because that was one of the...
That's great. I love the portrait around the eyes. It's possibly nearly my favorite anti-aging treatment, because it does things that nothing else does.
I'm so grateful for your time, Michael. Thank you so much for joining us on this day. Thank you again for all of this information. You're just a wealth of information. There's so much in there still that I want to get out. But I'm so grateful. Thank you so much, and we'll catch you again next time.
Thanks for having me. Hope everyone enjoyed it. Thank you.
Bye-bye.
Bye.